Hello. Today we want to begin a series of videos on the very interesting topic of chiropractic principles. Now, chiropractic principles may sound rather mundane, but in fact it's rather an interesting area because chiropractic principles have been so fluid, as they ought to be. The principles of a healthcare profession are not like the principles of physics, the laws of thermodynamics or Newton's laws of motion. They need to evolve over time as social values evolve and as scientific knowledge grows. And so, we'll take a look at the development of chiropractic principles through a historical lens, beginning with the founding of modern chiropractic by Daniel David Palmer in 1896 in the American Midwest. Daniel David Palmer, DD, was a Canadian who emigrated as a young man to Davenport, Iowa, and after working his way through a series of jobs, established himself as a magnetic healer. Now, magnetic healer may sound a bit flaky, and no doubt there was a certain spiritual aura to it, but I imagine that magnetic healing in those days was a lot like, professional massage therapy or physiotherapy today, although, of course, not nearly so sophisticated. In the American Midwest of the late 19th century, magnetic healers would have catered to, farmers and craftspeople, and these would have been a pragmatic clientele. These people had to work hard, and so when they were hurt or when they were in pain, they needed to be fixed up quickly so that they could get back to work and care for their families. And indeed, there's plenty of literature from the day indicating that this is the niche that magnetic healers occupied. So how do we get from magnetic healer to chiropractor? Well, here's the story as written down by Palmer himself. In the building where Palmer had his office, there was a janitor who had suffered hearing loss some years earlier. One day when the janitor and a group of men were standing around sharing a joke, somebody playfully but forcefully slapped the janitor on the back, and he noticed a transient improvement in his hearing. Later, the janitor Harvey Lillard related the story to Palmer, who of course had an interest in back problems, and Palmer inquired further. It turns out that Harvey Lillard had been lifting something heavy. I believe it was repairing a wagon wheel or something like that, but I could be wrong. In any event, he was lifting something heavy and straining his back and suddenly felt something give way in his upper back. And at the same instant, he became profoundly deaf. As he related the story, he couldn't hear the racket of a wagon passing in the street or the ticking of a clock held close to his ear. Now Palmer, who probably had lots of experience fixing backs, reasoned that since the hearing loss occurred just at the moment that the back was injured, there might be some cause and effect relationship. And he further reasoned that perhaps if he fixed the back, the hearing would improve. So he managed to convince Harvey Lillard to receive some treatment, and indeed, after just 2 treatments, Lillard remarked that his hearing had been completely restored. In fact, he later testified that his hearing remained good for years afterwards. Now, this was an extraordinarily interesting case, but this was not actually the beginning of chiropractic. One patient may be a very interesting case, but one case does not provide the principles on which to base a healing profession. In Palmer's own words, what really brought it all together for him and made him realize that he was onto something was his second patient. Without patient number 2, I'm convinced that chiropractic would never have been founded. Before going on to patient number 2, let's pause and talk a little bit about D.D. Palmer himself. D.D. Palmer was a self-educated man, and a well-educated man. From his writings, it's very clear that he had a firm grip on osteology and neuroanatomy, and so he understood very well the beautiful symmetrical arrangement of the sympathetic nerves arising from the spine. In his day, it was well understood that the nerves conducted electrical impulses, although neurotransmitters hadn't yet been discovered. Furthermore, it was understood that sympathetic tone was necessary in order for the viscera to perform their normal functions, and therefore if there was interference with nerve flow, then the viscera might not behave as they ought to. On to patient number 2. Patient number 2 had some kind of cardiac disorder, and Palmer described putting the man on a table and examining his back, and finding what he described as some upper thoracic vertebra out of place. Palmer then wrote that he reasoned that if the vertebra were out of place and pinching on the sympathetic nerves running to the heart, then this might cause some disorder in the heart. He further reasoned that if he replaced the vertebrae, put them back in their proper alignment, then this would relieve the pressure on the sympathetic nerves and so restore good health to the man's heart. And indeed, he described treating the patient and the patient recovering. Now, there's no reason to doubt Palmer's description of the clinical events, but let's think a little bit about his reasoning. Is it possible that a bone can get out of place? Well, I suppose that's true. Can a bone pinch a nerve? Yes. If nerves are pinched, can it affect the behavior of end organs? Absolutely so. But when one puts all of those steps together to formulate a general mechanism of disease, well, we're on kind of uncertain ground. And that is what Palmer did. From those two patients, he said that, as a general model of disease, vertebra could get out of place, pinch nerves, and create disease in end organs, and that replacing vertebra to their proper alignment would relieve disease. This was presented not just as, well, an exceptional case, but as a single unifying model of disease, the cause of all disease. Now, to imagine that one has found the cause and the cure for all disease requires an admirable amount of self-confidence. And from that conclusion, a number of interesting axioms flow. If one has discovered the cure for all diseases, what need is there for other systems of healthcare? And so chiropractic, in its conception, was not a complementary form of care. It was not meant to complement pharmacological and surgical care. It was intended as an alternative to replace all other forms of care. And that, of course, had all sorts of social and political consequences.